Healthcare diagnostic reports should not die as PDFs. Echo reports, EEGs, ultrasounds, labs, doctor notes, and medication history all contain clinical and financial signals that can affect coding, medical necessity, denial prevention, and payment. Beyond Care Diagnostic Report Intelligence turns that trapped information into structured, auditable intelligence. In this demo, I'm importing 3 different report types: an echocardiogram, an EEG-style diagnostic report, and a high-risk pregnancy ultrasound. The goal is not just to read the text. The system classifies the reports, extracts findings, captures measurements, and prepares the evidence for coding and claim readiness review. After import, the dashboard shows what was processed: files reviewed, reports imported, observations extracted, coding signals found, ICD signals, CPT draft signals, modifier review, and documentation gap review. Now we can see the report evidence becoming usable. For this echocardiogram, the system identifies cardiac findings and measurements from the report itself. It captures evidence such as left ventricular ejection fraction, diastolic dysfunction, left atrial dilation, Doppler-related findings, and diagnosis and procedure signals linked to the study. This turns a diagnostic report into a structured evidence layer that can support coding, documentation review, and claim readiness analysis. Next, the system surfaces coding review intelligence, possible ICD diagnosis signals, possible CPT or HCPCS draft codes, modifier review signals, and denial prevention or documentation gap items. These are not final codes. They are deterministic review signals for coders, providers, and revenue cycle teams. The important point is evidence. The system is not guessing. It ties coding suggestions and review items back to what the report actually says. That means the output is explainable, auditable, and review-ready. The first summary output is the Diagnostic Clinical Interpretation Narrative. It organizes the findings into a readable review note. It helps show what the diagnostic evidence appears to support and what areas may deserve coding or provider review. The second summary output is the Claim Readiness and Medical Necessity Preview. This connects report evidence to possible ICD, CPT, modifier, and denial prevention signals. It helps answer a key question before billing or appeal. Does the documentation appear strong enough to support the coding and payment pathway? This is where Beyond Care becomes more than a report reader. It moves upstream into the diagnostic report layer, where documentation, coding, medical necessity, and preventable denials often begin. Instead of waiting for a denial, the system helps identify issues earlier. Beyond Care is part of the larger Beyond Health Systems intelligence layer. Reports can connect to notes. Notes can connect to medications. Medications can connect to diagnoses. Diagnoses can connect to claims, payments, denials, appeals, and payer behavior. This is the healthcare connective intelligence layer in action. Not black box AI, not a simple PDF viewer, not just a coding lookup, a deterministic auditable system that turns diagnostic report evidence into clinical, coding, modifier, and claim readiness intelligence.